What about clinical decision support? So think about that. Think about if you're a cancer patient, right? And you failed the standard treatment and it's looking very terrible, right? Well, you're desperate. Well, your doctor now can basically go in to a variety of websites and they can match your genomic profile with your best treatments on clinical trials. And it's fascinating. It's wonderful. One of our graduates who actually teaches for us adjunct, he works in Chicago now for the ASCO, the American Society of Clinical Oncologists, and he runs their clinical decision support initiative, which is basically taking the big database that they have as a nonprofit organization of all of the clinical trials that are available out there for cancer patients, and they make it available and integrated into an Epic or a Cerner into the EHR. So a provider then can write a query. And another key thing about personalized medicine, and that this cuts both ways, and this is where ethics and privacy get into it. You know, if you could take a genetic test right now and know the likelihood that you're going to have Alzheimer's disease in 30 years, or if you can take a genetic test right now, and they take your family history, right? Oh, what your grandmother, your grandfather, your mother, your father, your brothers and your sisters, and that's normally what they take. And what they try to do is from the family history make some prediction about your care, right? Oh, my brother-in-law's got a condition that his father had, right? And it's highly predictable. Well, we're getting very close to the point where we're going to be able to do that with genomics. Okay. And that's another area of health informatics. Now that may not be for everybody on this call. That's really the geeky stuff, right? That's writing the SQL queries. That's really getting into the databases, but it's still a very important piece, right? And you don't have to know how to do that. In our program, you do take a basic class in programming, but you don't, it's the students who really want to specialize in that. So you learn about most current treatment. Most important is the alerts. So let's say they make a mistake with the prescribing. What's the number to err is human? There's a classic article, a classic study that was published about 15 years ago about the number of people who are killed in hospitals and by doctors, right? I mean, it's even like giving the wrong medicine because of an interaction, like not knowing perhaps you had a reaction to penicillin, or it may be possibly an alert because of the amount they prescribed or an interaction between two drugs, right? Like you're not supposed to have antibiotics and some type of vitamins, and so most importantly, it's if you put in the wrong number, and there used to be this huge problem. If you heard about doctors' handwritings, right? They used to write a script and you used to give it to your pharmacist. I don't know if anybody's old enough to remember that, but the doctor would write a script, you'd give it to your pharmacist, and the pharmacist would look at it and try to read what was said. I mean, I've got some great actually videos on that of what it said. Now this is all done electronically, right, through e-prescribing. And 96% of all scripts in the United States today are electronic. So the docs can still phone them in, but really it's an issue of all of that is done electronically now, so we have a lot fewer errors. And also there's CDS at the pharmacy, because you may be going to two different doctors and they may pop up and say, hey, wait a second, another doctor is giving a drug that's going to interact with this. So that's another one. Another type of error you may not consider an error is like opioid prescriptions. We have something now called the PDMP, Prescription Drug Monitoring Program in Casper, which is called Casper in Kentucky, which actually looks at the amount of opioids that are prescribed for an individual to try to reduce the amount of addiction that occurs in doctor shopping and illicit use. So there's a lot of ways we use CDS, right? It can also act as an extender. The provider can look something up immediately on the computer, or the computer actually can come up and say, do you want to know about clinical trials for this patient, right? And you just click on it So you can use artificial intelligence, you can use machine learning. This is like in one of the areas I spend a lot of time talking about in my classes, which is artificial intelligence is really hyped. Okay. All it is linear algorithms, if then or buts, right? It is not really computer learning. It's just taking the if allergic to penicillin, uh, uh, don't prescribe, and then it'll tell what drugs. Okay, that is artificial intelligence. Machine learning, on the other hand, is actually taking the data and having the machine iterate and look for patterns, right? And take the personalized medicine and look for patterns and come back with a better way to treat the patient. So AI is really just linear. It's taking what we already know, right? It's like in a cockpit. It'll tell a pilot how to fly, right? But it's all pre-programmed. Machine learning is actually getting to, the very futuristic area where you have health, where you have the computer being smarter than the provider. The computer able to compile all of this information and come up with a suggested treatment. I think we're about 10 years away from that. And there's going to be a time where a doctor is going to have to justify her or his treatment if it varies from what the computer tells them. Okay, that's going to happen. And that's all health informatics too. Yeah, as you're going to talk about how it all works. I mean, this is, if I had any geeky questions, I was going to talk about how clinical decision support works, how you have data in and you have the data here is the knowledge, and then you have either a linear, I'm pointing, it doesn't do any good, linear algorithms or machine learning algorithms that'll help you get to various outputs. But that's kind of, it's an interesting area, and we have a lot of students interested in that area.